The governor correctly identifies retiree health liabilities as an important problem. However, we think his proposal also raises important questions that the legislature should consider. We recommend that the policy committees of the legislature hold hearings to discuss these issues and to seek input from professional actuaries, employee representatives, and policy experts when considering the governor's proposal or any other proposal to address retiree health liabilities. Before the legislature considers the specifics of a funding plan, we think the legislature should first consider two fundamental issues. These two fundamental issues stem from one question: how should the state approach health benefits for retired state employees after recent changes in state and federal laws? Specifically, under the pension formulas established by the state's Public Employees Pension Reform Act, future employees likely will retire at an older age, closer to the age at which they are eligible to receive health care under the federal Medicare program. Additionally, the Federal Patient Protection and Affordable Care Act makes it easier for people who retire before being eligible for Medicare to purchase health insurance. Because of these two issues resulting from recent changes in law, future state employees may not value today's retiree health benefits as much as they cost. Therefore, the state and future employees might be better off if the state made significant changes to its retiree health benefits in the future. The legislature's decisions on these two fundamental issues will determine the structure of any funding plan to address retiree health liabilities. In our report, we discuss these two issues as well as other specific issues that we think the legislature should consider while deliberating the governor's proposal and any other proposal to address retiree health liabilities. In the end, we think it's important that the legislature not rush in developing a funding plan to address these liabilities. We acknowledge that any delay, whether it be a month or a year, could make elements of a funding plan more expensive. However, we think it's more important to take time to implement the right plan than to have a plan in place in time for 2015-16.